Okay, now the next question is, if the patient has the right to decide, does he have the decision-making capacity to decide? Decision-making capacity, or the capacity to decide, is very easy to determine. Can he understand the information? Can he think about it? After thinking about it, can he make a choice that he can communicate in any understandable way, verbal or non-verbal? Then, if he has all these four, obviously he has decision-making capacity. Now, this is also the basis for the legal concept of competent to decide, legally competent. So someone who's legally competent must be able to decide, so must have decision-making capacity. Of course, it's the law, so the laws usually have to be more concrete than that. In different countries, they set threshold age. So meaning, if you're younger than this particular age, it does not matter whether you have all four, you're still not competent to decide for yourself. Of course, the reason behind that is related to the requirements. And the suggestion is, if you're below so-and-so age, you're not mature enough to think or choose, etc. The Johnson table has been presented several times probably to you during your earlier years, and this will be just a review. This is a form coming from a hospital in Seattle, Washington. The Johnson table is actually in the first page. It's composed of 4 boxes, and if you look closely, the boxes says medical indication, patient preferences, quality of life, and context. The basic idea behind this is this. If you are faced with an ethical dilemma or you have to make decisions, then it's better to consider all the relevant important details or information about the case before you start discussing it and before you agree on a decision and an action. So obviously, if you have a lot of information that's relevant, then you'll probably have better decisions and better agreed upon actions. Advanced care directives, or expressions of advanced care preferences, made through a process of advanced care planning. If we look at the term, it's done in advance, meaning it hasn't happened yet and the patient was given time to think about it. It's about care. Usually it's care near the end of life. Care preferences that the patient wants related to if and ever he gets worse or if he may die. And its preferences is the patient's own preferences. It's again an advanced directive. In advance, the patient thought about it, he put it down or he recorded it, and it's a directive. He's hoping that everyone around him would recognize and pay attention to what he wants. Law on advanced directives in different countries. Please take note that different countries will have different laws on self-determination and advanced directives. A lot of our reference books and textbooks came from developed Western countries, and most of them have laws on advanced directive forms and the patient's right to self-determination. In other countries, such as ours, we do not have laws about advanced directives. So we don't have that in the Philippines. The forms that we have don't have the same legal weight compared to the forms they have in the other countries. Meaning, just because there is a form and the patient signed the form in front of the doctor, it's not as weighty as the same kind of form executed in the United States. Now the question is, if it's not a legal requirement and if it's not that important as far as the law is concerned, how come we're doing it? And the answer is, we still think it's important to do the planning and come up with a directive because it helps everyone. It's good for the patient and the family to start talking about care preferences near the end of life, because these kinds of discussions take time and it's hard to do when things are already getting worse and a lot of problems are urgently requiring decisions. Even if the form is not legally weighty, the form expresses an agreed upon set of decisions accomplished by the patient with members of his family. And therefore, when the time comes when the hospital or the doctor would need to ask the legally designated surrogate decision maker, things would be much easier for the family, the surrogate, to decide. Advanced care planning. Step 1. Please note that an advanced care planning is actually a set of decisions. And if you review our previous sessions on disclosure, goal setting, and decision making, especially those involving withholding or withdrawing life-prolonging measures, the first thing that needs to be done would be to make sure that the information is clear and everything was disclosed, communicating bad news and such. After that, since the information has changed the situation and the context, then goals have to be reviewed or reworked if needed. After goals are clear, then decisions inside the advanced care plan can be done. is very important because you don't want to have families discussing things with different goals in mind, and with some family members unaware that there are new informations or the developments that have happened. Explain what it is. In many countries, people already know, but not every country. In some countries, people might not know what an advanced care plan is. So imagine what the person would think if you just hand him a form asking him about CPR, ventilator, something to jumpstart the heart, and things like that. So they will probably think that the hospital or the doctors think he's about to die in the next few hours. So explain things clearly so that it doesn't appear threatening at all. A good suggestion would be say that an advanced care directive does not imply that everyone thinks he or she is going to die really, really soon, although that might be the case. Clearly, everyone is hoping that he can still survive, but even the patient would agree that his condition is severe enough that something might happen. And therefore, the advance directive tells everyone what the patient wants and what the patient does not want, because the healthcare provider wants to do everything to do what the patient wants and not do what the patient does not want. This also helps his next of kin decide if ever he or she was asked. Okay, then say you can change it anytime. Some people would not want to accomplish these forms because they think once they sign a form, which actually looks like a contract, then that's the end of it. And then the question is, what if they change their mind? Tell them that if they change their mind anytime, even this afternoon, just call you up and you'll change the form right away. The most important thing is we have what they want on paper so that people will know what it is. Next one, give them time to decide. This is very, very hard to do. It's very emotional, and therefore it's very unusual to accomplish this thing and come up with decisions on the same day. Give the patient and the family time to talk things over and decide. Offer your help to accomplish the form, especially if there are certain statements or terms which are unfamiliar to them. And then after the form is accomplished, make copies of the form for it to be useful. So the institution or the hospital and the patient's doctors would have copies, and the family would also have copies. If ever the time comes, then it's just a matter of telling everyone this is the advance directive.